Doing. Oh. Hey y'all, we're gonna get started in a second. So I want to give it a few moments to let people come in and join us. Really excited for this chat we're gonna have. This is gonna be my first one facilitating. Some of you may know that I do the safe and just policy alerts, but I'm really looking forward to facilitating a conversation. I think I'm better doing that than I am just talking to the camera by myself. So we'll get started in a second, y'all. Nice. All right. You ready to go? You good, Kieran? All right, good. Well, welcome everyone. Thank you for joining us on this Healthcare Not Prisons live chat we've got going today. Anthony DiMartino. I'm the Government Affairs Director for Californians for Safety and Justice. Really excited to be here with you all on this Wednesday afternoon. We're in September now. Legislative session just ended, right? A lot going on, y'all. But yeah, I want to first welcome our guest today, Kieran Savage from California Pan-Ethnic Health Network, the executive director. Just an amazing organization. I could say so much, but it would be better coming from her. So Kieran, please feel free to introduce yourself and tell us a little bit about your organization.
Sure, and thanks for having me. Like Anthony said, my name's Kiran. I'm the executive director at the California Pan-Ethnic Health Network. We are a statewide multicultural health advocacy organization, and so what that means is that we work really closely with communities of color across the state to advocate in Sacramento, as well as in many of our local counties for equitable health, mental health, oral health and public health systems, access to care, and quality of care for the folks that we work with. So really excited to be here with all of you today to talk about, I think, the really important intersections between criminal justice reform and healthcare reform.
Yeah. Thank you for saying that. I think a big reason why I do the work is because of the intersections. I do criminal justice work for several years now, and as a social worker, I saw criminal justice is kind of where all of the big issues funneled into. And as a social worker, I want to cut that funnel off, and I think the work that you all are doing it is a big piece of that. And so really excited for this conversation that we're going to have. I should probably say a little bit about CSJ in case folks are joining that don't know Californians for Safety and Justice. So we are a statewide advocacy organization that advocates for criminal justice reforms and state budget and policy reforms to really reflect the needs of the communities of the most underserved and most harmed and least helped. Which I think is going to speak to the conversation that we're going to have today. We organize survivors of crime with the Crime Survivors for Safety and Justice, and we organize folks that are formerly incarcerated in our Time Done movement. So whether you fall into that bucket or one of the other buckets, or you're here just to learn about this, thank you for joining us. And let's get this conversation started. So before we really jump into it, though, would love to hear from Kiran, like how you got into this work. I'll share a little bit about mine after, and then we'll talk about the Progress Not Prisons public education campaign, and then dive into some questions.
Sure. Thanks, Anthony. So I actually, for most of my professional life, worked in the immigrants' rights movement because my parents are immigrants, right? It's a personally important issue to me. And in doing that work, I think one of the things that became really clear is there's a lot of things that are broken about our immigration system, but one of the most broken parts is where it intersects with our criminal justice system, right? Because we are using law enforcement and criminal justice to punish people for making decisions to be with their families, to take care of their families, et cetera. And so that really made me take a kind of a deeper look at how does our criminal justice system work and why is it so broken and what are all the impacts that it's having. And one of the things that really stood out to me is how we treat people who are experiencing a mental illness or some kind of mental health condition, how we really have decided as a society to primarily respond to those situations with law enforcement, with policing, with incarceration, rather than with health and mental health care. And so that really led me to be here at CPEHN, to doing this work around how do we make sure that particularly communities of color, are able to be healthy, to be well, and to live in healthy and well communities as well. So, that's how I got here today, and why I continue to really, I think, focus on this intersection at CPEHN. And Anthony, would love to hear more about you and your story as well.
Yeah, well, thank you for that. I mean, and I totally can relate to that. I think, similarly, I had an interest in mental health. Struggling myself, being transparent with some depression and anxiety growing up. I wanted to understand, what was behind that. And I studied psychology, and then I fell in love with working with youth that were in the juvenile justice system and that were touching the criminal justice system, because I felt like I could have been one of them. I related to their experiences. And so I got into this work because I wanted to do everything in my power to eventually shut down DJJ and our juvenile halls, so that kids weren't going to that system that we know only further recriminalizes them and re-traumatizes them. So, big news actually before I jump into the campaign, right? SB 823 passed the legislature on Monday, which is setting a closing of the DJJ intake, so that we are really, as a state, moving to close our state juvenile prisons, right? So, which is huge. Bring these kids closer to home, where we know we're going to get better health outcomes, better mental health services, and keep them closer to family. So, that's how I got into this work and why I do the work. But thank you for asking.
And thank you for providing that update. That's amazing news. Congratulations to you and everyone who's been working on that.
Yeah, great work. CSJ definitely supported and helped some of these other juvenile justice orgs that have really done a tremendous job over the years, setting the stage, and the legislature came through. And, I fully expect the governor to sign this, hopefully in the next couple of days. So it's huge. And so thanks for highlighting, the policy update, so with this public campaign, right, my job as the government affairs director is to really work on the policy and the budget side of things for the state. And as we launched this public education campaign, Progress Not Prisons, and today we're focusing on healthcare, not prisons. We really launched this to look at the $50 billion, right, that the state of California and the counties and the cities spend on our criminal justice system, right? And in the 5 years that I've been in Sacramento working on policies and budgets, right, we passed some tremendous reforms. Just name that one. A lot of racial justice, criminal justice reforms were passed over the last couple of days. And so with that, though, we haven't really seen, reallocation, redistribution of money, right, to the services that we need them to go to: education, to our economy, to healthcare. And so that's really what this campaign is about, is to bring to light what could we do with very small percentages of this $50 billion, and really bring to light like how much we have invested in our prison systems over the last several decades, right? And now that we are reforming the system, it's time to really, though, look at our budget and understand that our budget is a representation of our values, and how do we start imagining a new system and imagining how we use this money. So, with that, I'd love to ask you the first kind of question to kick this off. What are some of the connections that you see between this public education campaign, Progress Not Prisons, and your advocacy for necessary investments in meeting the health needs of people of color?
Yeah, that's a great question, Anthony. And I first want to make sure that people heard you right, that Anthony said 50, and billion with a B is the number that we're talking about. And so there's really no part of our state that isn't impacted by spending that amount of money in our prison system and in our criminal justice system, right? So I just want to make sure we all heard the same kind of eye-popping number there, because that's really what it is. So, Anthony, your question was about what are the connections between this campaign and about the advocacy that we do at CPEHN for necessary investments in health and mental health. So first, I want to say that this is a matter of how we allocate our resources. And it's also a matter of what is the negative impact of the amount of over-policing and over-incarceration? What is the negative impact of that on health and mental health of communities? Because it certainly is that means we're not spending the money we should be spending in those systems, but it also means that there are consequences about how we treat communities, how we police communities, directly on the health and mental health, particularly of people of color. And, you know, in our work, we know that living in a community that is over-policed, being a person who's targeted by law enforcement, unfairly, unjustly incarcerated, that has a very negative impact on your mental health and well-being, and also on your health and your health outcomes. And so we have to really talk about that, I think, when we're talking about this issue, that part of the reason that we have such a significant need for mental health is because of how poorly we treat people, and that our criminal justice system is a really big part of that, right? Because we see every day the trauma, the adverse health impacts of living in this over-policed state, and dealing with the consequences of that. I think the other thing we know is that healthcare, sort of writ large, including mental health care, is the right place to be supporting people who are unjustly impacted by other social issues, right? Whether it's homelessness, whether it's violence in the community, that those kinds of issues don't deserve a law enforcement response. A law enforcement response is ineffective. What is effective is a public health and health response. And that's what we don't do enough of. And that's what, from CPEHN's perspective, I think we really see the connection with the Progress Not Prisons campaign, because what's standing in the way of us having healthy communities often is our extreme overinvestment in prisons.
Yeah. Can you talk a little bit about maybe just some of the work that you all have done? And it may not be specific, right, in this connection, but just some of the work that you all have done to try to mitigate some of these things that you all have seen, and other work that you advocate for. Would love for the people tuning in, and me personally, I'm familiar with the org because of my work in Sacramento, but would love to hear a little bit more about some of the things that you all would like to highlight that connects it in this space.
Yeah, absolutely. So we work very broadly on healthcare and healthcare access. And one of the things that we see is just the sheer number of people, particularly people of color in California, who don't have access to healthcare, right? Who either don't have health insurance and therefore are very wary of seeking healthcare even when they need it because of the extremely high cost of healthcare, or people who have health insurance, right? Whether it's through their job, whether you're enrolled in the Medi-Cal program, whether you've purchased a health plan through Covered California, even if you have health insurance, that there are really significant barriers to accessing healthcare at all, right? The amount of time that people have to wait to see a doctor, to see a therapist, to see a specialist, whether it's that you need a cardiologist or something like that, the amount of time you have to wait, potentially the distance you have to go to get there, all of those things are really big barriers that we work to tear down in our work with state policymakers. And I think the other thing that's really important here is that we know that even for people who have access to healthcare, and when it comes to communities of color, often that healthcare, and in particular that mental health care, is actually not what we need, right? It's not necessarily most effective. It's not responding to our situation, our culture, our health needs. And so what we see is people of color having what we tend to think of as worse outcomes from healthcare. And so what that means is maybe not getting sort of the help they need from seeing a therapist, that their mental health doesn't improve in the way they would like to see it improve. And so we do a lot of work to say we need to have a different kind of healthcare system in the state of California, one that is responsive to all people and that meets our needs. And so some of that looks like sort of reimagining specifically mental health care and saying this may not look like, a person and a psychiatrist. This might look like cultural programs that we have in our communities. This might look like, sister circles, right, in the African American community. This might look like tribal healing practices in the Native American community. And that it's really important that we sort of think outside of what we have today and really honor what communities have done for themselves, right, to have health and to have mental health. And so we do a lot of work to lift up those types of practices and to really encourage both the state and local county governments to invest in those kinds of practices.
Wow, that's great. I mean, I could go a lot of different directions with everything you just said right now. I think one thing I wanted to highlight, and to bring this one kind of personally, and then also to the connection to law enforcement and criminal justice in general, right? Is the way the body reacts, at least for me as a brown man, when the law enforcement siren lights go on, and it may not because they're pulling me over, but just the way I react, right? I tense up, my heart starts racing, I feel like I'm holding my breath, or I can't catch my breath, right? And I don't have a whole lot of interactions with law enforcement anymore, and I don't live in a community right now that I would say is over policed. There's definitely a police presence around the Capitol because of other things, or not necessarily related to violence, but around homelessness, and it's the Capitol. But to live in a community where you're constantly interacting with law enforcement and having that reaction, I got to imagine, right? That's gonna take a toll on me, right? That's gonna we've talked about violence and police violence having this effect of of anxiety, PTSD. They call it PTSD, but they don't call it post-traumatic because you're always living in it, right? So can you say anything else about that, and that direct kind of just what that does to the body and the stress of that?
Yeah, absolutely. I think what we know from a lot of the research on what people refer to as adverse childhood experiences, right, ACEs, but isn't just for kids,
Nope.
Is that when you are in those stressful situation, it changes things in your body, both for your mental health and for your physical health, actually, is one of the things that people are increasingly paying attention to, right? And basically living in a traumatized state makes you sick, right?
Yeah.
Which isn't a surprise, I think, to those of us who work in communities that experience this, but I think is not something that our systems are set up to acknowledge and to respond to. And in fact, rather than, providing the support and the healing and the resilience building that we need, we continue to perpetuate the traumas on people, right? And so it really is, I think, a really significant part when we talk about both mental health and health broadly.
Yeah. And, I just highlighted just one kind of instance of the sirens going on, right? And then can you imagine if you get pulled over, right? And then you get arrested, and then you have to go through the whole process of the court system. And then if you do have to spend time in jail, and what we know about prison conditions and jail conditions. And then if you ever do get out, right, what you're facing when you try to re-enter, what we know and what we work on here at CSJ, right, is making sure that we remove those barriers that are placed on folks when they come out with a criminal conviction. And so, the whole system is just traumatizing from the very first interaction till you get out, and then you're still being traumatized. We take voting rights away from folks when they come out and they can't vote on parole. So, I just wanted to highlight that. And the other thing that you said that really resonated with me, right, was the disproportionality of folks that are people of color that don't have healthcare, or that do have healthcare and may not utilize it, or they face stigma and racial bias from the healthcare system, right? Well, we see that obviously in the criminal justice system as well. There's that connection, there's that through line, right? That disproportionately Black and brown men, and now too many Black and brown women, are being incarcerated and have been incarcerated in this country. And, we can trace that all the way back to slavery. But, I think I just wanted to make that through line of what we're seeing with the healthcare system and who doesn't get service, or when they do get access, they're not getting the right services. Unfortunately, Black women go in, and maternal health for Black women, we know is terrible as well. I'm sure you can speak more eloquently to that as well than I can. But I just wanted to make that through line of the disproportionality.
Yeah, absolutely. I think that's absolutely true. And I think this is sort of now, everybody sees this, I like to think, now with COVID, right? Yeah. And what we're seeing with COVID, which I think is another really important thing to talk about, right? Because what we've learned from COVID, one, is that having a really broken healthcare system has a big impact in a pandemic. And we see that in the disproportionate rates of people who are dying from COVID, particularly in the Black community, because we didn't deal with their healthcare challenges earlier, right? So people are dying because they already have asthma, they already have diabetes, they already have heart conditions that we ignored as a healthcare system and we did not invest in. But the other piece that I think is really important to think about is our public healthcare system, which we talk about so little until we're in a pandemic, right?
Yeah.
And if you were to look at sort of the graphic of our spending on law enforcement and our spending on public health, our law enforcement spending goes like this and our public health spending goes like this over the last decade, right? We have completely abdicated our responsibility to public health in this state, and now we are paying the consequences in the most dire circumstance we have been in, right, in our lifetimes. And so just to put some numbers to it, because I think it's really important that people understand that, what we're seeing in terms of how COVID plays out, a lot of this was preventable, right? But we spend less than 5%, less than 5% of county budgets on our public health care systems, right? It's a teeny tiny number when you look at it. We spend over 4 times that amount on law enforcement just in the county systems. And your $50 billion takes into the state prisons and all that, but just in the county systems, at least 4 times as much on law enforcement, on the sheriff, on the jail, as we do on our public health care system. And so what does that mean today? It means that today we were entirely unprepared to respond to COVID, and we still are. And the consequences of that are our schools are closed, people are dying, our small businesses are closed, people are losing their homes, they're losing their businesses, they're losing their jobs because we don't have a public health infrastructure, because that money went to the sheriff, right? And so I think as we have this conversation, both about healthcare and frankly about our economy, we have to be real about the choices that we have made as a state over the past decade and how we got to where we are today in this moment of COVID.
Yeah. Wow. Thank you. I mean, that's a travesty, right? And the whole time you were talking, I just kept thinking about how we talk about the criminal justice system not being broken, but like set up by design, right? This is how it's supposed to work. And really how, in my opinion, the country was set up to work from the founding of it. And from the lack of investments in our education system, which then translates to our lack of, especially children of color being able to go to college and pursue, public health degrees, medical degrees, right? And then also just our lack of belief in science, and questioning, those folks in that field, and rather listening to just the law enforcement individuals and their voice. And we see that also outweighed oftentimes in the Capitol when we're trying to advocate for changes, whose voices get uplifted and whose don't. So really appreciate you, dropping the mic on that statistic. And you kind of covered and you started going into the next question I had for us. I'm wondering, what are some gaps that you all have encountered in your work that you think most often are a direct result of the lack of funding and investment in the health and well-being of communities of color? So I think you've covered this a little bit, but would love to hear if there's anything else you want to add about gaps that you all are seeing.
Yeah. So when I think about, we talk about health disparities or health inequities, right? I think you can sort of summarize it when you look at life expectancy, because ultimately everything that goes into our health sort of comes out in our life expectancy. And we have about a over 10-year difference in the life expectancy of people who are Black versus people who are white and Asian, right? And so that's a decade of people's lives that we're talking about that people lose because of systemic racism in healthcare and in our environment. So when you talk about how do these things show up and what do we see in terms of gaps, for me, it sort of boils down to that, as well as the quality of life that we are providing for people, right? When we think about healthcare, and are people able to live their lives and feel healthy and do the things they want to do with their families, we see a lot of challenges with that. We also see this when it comes to mental health care, really significant, I would say, suffering, right, in communities of color because of the gap that we have created by our lack of investment in these systems and in these supports, and frankly, in just having a healthy state, right? And sort of to bring it back to COVID, right, I mentioned we're seeing both higher death rates in the Black community. We're also seeing higher rates of contracting the virus in the Latino community. That all sort of speaks to the real weakness of our social safety net, because again, we don't invest in it, right? We do the bare minimum or below the bare minimum
Yeah.
for people. And so we're really seeing that gap, right? When we're in a pandemic and people can't afford to stay home when they need to stay home because they have to go to work, because there is no safety net to catch people in a situation like this. And so we really see that in terms of the impacts on communities, which is one of the reasons that, you know, we at CPEHN are calling on the state and on the governor to declare racism to be a public health crisis.
Yeah.
Because it is, right? And because if we don't acknowledge that, and if we don't start acting with urgency to make the changes that we need to make, we are going to continue to even more deeply embed the inequities and the pain and the suffering that we see today.
Yeah, I appreciate you highlighting that. I know I saw a ton of legislators actually sign on to a letter calling for the governor to do this. So, you know, I hope we can stay in contact about that. You know, our organization is about criminal justice reform, but, you know, I truly believe the work that we're doing in connection with you all is racial justice work, you know, because of who we're disproportionately affecting and impacting. And I think, you know, I'm really glad actually that this just came to the top of my mind. I'm really glad that you brought up the age expectancy, because I was just having this conversation with a staffer a couple of days ago around prisons and age expectancy, right? Mm-hmm. We just saw a bill pass the legislature that was trying to reform elder parole reform, right? So we have this thing in the prison system where, you know, if you're a certain age and you've served a certain amount of time, you get the opportunity to go up in front of the parole board, right? But, you know, in prison, research has shown that prison ages folks tremendously, accelerates that. And so, you know, someone may go in at 30 years old, spend 10 years and be 40, you know, by their birth certificate, but look 50 inside, right? Or 55 because of the trauma and the prison conditions, right? And so, you know, we use that to try to reform the system by talking about that and being like, look, these individuals may only be 50, you know, by their birth certificate, but really they're like 65, 70. And what we know about data when someone commits new crimes, folks generally after 45 or so aren't committing really crimes. It's usually generally folks that are younger, that are having a hard time getting a job, right? That are dealing with other social issues. So, you know, I appreciate you bringing that up, because there's just another connection, right, of who we know is, you know, dying in our prisons, right? And the age expectancy. So, you know, appreciate you making that connection easy for me. I want to kind of transition us to, you know, thinking a little bit about solutions. And, you know, I think you used the word, you know, dreaming and reimagining a new system of healthcare and public health. You know, so polling reveals that California voters, overwhelmingly majority of voters, would rather see their taxpayer dollars invested in healthcare than prisons. I imagine, I would like to think that they would like to see taxpayer dollars invested in a lot of other things than prisons. But how would you imagine people and communities you serve would advocate for resources to be used? Let's just say 1%, right? That's what my organization's been talking about, just 1% of the 50 billion. How would you imagine communities that you work with would advocate for these resources to be used?
Yeah, and I do think we should ask for more than 1% of the 50 billion, right? But it's a good place to start.
Yeah.
So I think first, what's, you know, front and center on most of our minds continues to be COVID. And so if you sort of imagine what 1% of $50 billion, which is $500 million, if I'm getting my zeros right, what could that do in this situation, right? So we're living in a time where we have a pandemic, and what we need is more testing for COVID, faster testing for COVID, more contact tracing so we can figure out who has been exposed to the virus, and more social supports so that people can isolate and quarantine when they need to. So if you had $500 million more to do that work, I think that our state would look dramatically different than it does today. If we were able to make sure that everybody who might have been exposed to COVID gets a test, that we turn around the test results in enough time for it to be effective, that we can trace where people have been to inform people that they might have been exposed, and that we can support people so that they don't have to expose themselves by going to a job because they need that money. If we could use $500 million to do that, I think our state would look dramatically different, right? And so this again comes back to that's what it will take to reopen schools, to reopen businesses, to keep people safe, to allow us all to socialize with our friends and families. So I think that's the first thing that our folks would say, today that's urgent and we could do that, right? The choices that we're making about COVID right now are what's leading us to the results that we have. It's human choices and state choices that we're making. In addition to that, when we think about mental health care, right, what could we do with that amount of money to really create a safety net for people, to create a wraparound of mental health services? And a lot of the work we do, we work with either small grassroots community-based organizations or even less formal than that, right? Just communities that are coming up with their own mental health solutions, but don't have any resources or investment for them. So we could invest, we could make sure that children have the supportive and wraparound mental health and wellness services that they need from a very young age, particularly if they've been exposed to trauma. We could make sure that across the lifespan, as people have needs, they can access not just any kind of mental health service, but something that's right for them, right? Rather than having to sort of navigate through a system that's very crowded and very broken. We could have a state in which people have those needs met, right? And so that's really when we think about, what else could you do if you were willing to make even just what you've proposed, a very small change, right, in this picture. That could include those things. That could make sure that everyone in our state has health insurance, right, which seems so basic in this era, but we still have people who don't have access to health insurance. And so they're not going to the doctor and they're not getting their mental health care. And they're scared to get a COVID test because they think they're going to have to pay for it, right? And so if we were able to provide every person with health insurance, that's something that would make a huge difference.
Yeah, I mean, just that last point alone, I think I have some friends that are doctors and PAs, and they tell me about folks that come in that aren't don't have insurance, and they've waited till it's the worst that it could be, right? And then their outcomes are looking very bleak if they come in late, right? And so you're not even able to do the preventative care for folks, and too often I think that's what's leading to these terrible life expectancies for folks. It looks like we got a question coming in. And so, Kiran, are you good with taking a question? It looks like we're seeing this question saying, interested in hearing what keeps all of us hopeful as we continue to do our respective work. Before I get to that question, I wanted to say one other thing about this 1%, right? And I think it's related to this. Our organization works really closely with trauma recovery centers, right? And I think we're at 12 right now. Apologies to my team out there if I'm getting that number wrong right now. But, I think we're at 12 for the state of California, which, I think it leads the country in trauma recovery centers, which also, says something about the rest of the country. But, we only have 12 for 40 million people. Yeah. And to think about all the folks that have been harmed by violence, right? By these systems that were set up to harm folks or to not help. I'd love to see more money invested in our trauma recovery centers. And then also, I don't consider the reentry necessarily services criminal justice, but it kind of falls in that when you're talking about it in the state capital. But those services, I would love to see more funding there, which is around housing, around economics, around education access. So that's where I'd love to see some of this money go to. Not sure if you wanted to say anything. I saw you nodding about the trauma recovery centers, but feel free to jump in.
Yeah, I think the trauma recovery centers are a great example of when we think about community designed health and mental health care and sort of responding to what the community feels like would help. I think trauma recovery centers are a really good example. And so I think definitely greater investment in those is sorely needed. I agree with you, Anthony.
Great. Thank you. Always good to have people agree, But so I want to get back to this question that looks like it came in through Facebook. So you want to share with everyone listening, me, I'd love to hear as well. What's keeping you hopeful at this time when things are really hard, really, really challenging to say the least?
Yeah, I think it's a really good question for us to try to think about every day, right? Because it is really hard times. And what keeps me hopeful is people who who do the work, people who stand up to injustice, the folks that you work with who have been impacted by the criminal justice system, right, or are survivors. I think those are the folks who keep me hopeful, because that's what this is all about, right, is people standing up for themselves and their communities, asking for what they need, and really just being, I think, champions for all of us. That's what keeps me hopeful. What keeps you hopeful, Anthony?
I mean, ditto. I mean, that's why I do this work, right? And what keeps me going, until we're all free, none of us are, in my mind, right? And my humanity is wrapped up in everyone else's. I would add on that something that I've seen a lot more recently, and I think because of COVID and people are just paying attention because, one, they're at home and there's not a lot to do for some folks, but people are like asking questions. People are really wondering what's going on at the federal level, right? I get a lot of questions from folks who for years have not been interested in voting, who've not been interested in government, and I was just talking with one of my colleagues earlier today, like if I knew government was like, exciting isn't necessarily the right word, but like engaging the way that I have to work with it. If I knew it was like this when I was taught this about government in school, I would have been involved way earlier. Because there is so much to government, and there's so many analogies in my mind to sports, right? But I think what makes me hopeful is like those folks that haven't been engaged, right, or that don't necessarily have the skin in the game the same way as some folks that have been impacted, that they've been asking questions and they've been like, how do I help? Who do I donate to? So that gives me hope. I have probably that conversation once every couple of days with someone new, and that gives me some life.
Yeah. Which I think reminds me, I'm sorry if you were going to do this, Anthony, but people should know that there's an election in November, and without getting into specific issues, if you are eligible to vote, or if you're not sure, now is the time, right? I believe you can go to registertovoteca.gov. Correct me if I'm wrong about that, Anthony, but really, sometimes I think we feel like our vote doesn't matter, but our vote always matters, whether it's on the national level, whether it's thinking about who we want to have for the next president, or whether it's on a local level and thinking about who's making budget decisions in your county and do they reflect what you want to see. Really, now is the time to get involved, to make sure you're registered to vote, to make sure you know how to vote in this election, because it's strange times, right? So making sure that you have that information, making sure your friends and family have that information, I just think is so critical.
Yes, thank you so much for highlighting that. I think yesterday we just launched our Crime Survivors for Safety and Justice just launched Heal the Vote, and we're going to be highlighting why folks vote, and how that plays a part in healing them when they've sustained trauma, because voting is empowering. It does feel powerful when you can pick who's representing you, and when you're educated on that too. So really, there we go. We got cssj.org/vote to learn more about that. So thank you so much, Kiran, for highlighting that. Is there anything else you'd like to highlight, or we'll see if any other questions come in from our team? But is there anything else that you think is important to just let folks know that are tuning in?
Well, I would reiterate sort of the call to get involved in whatever way is meaningful to you, right? I think we all, do different things that sort of move us and make us believe we're making a difference. So to get involved sort of for the reasons Anthony mentioned too. And also, I think this is just a really important time to sort of be connected with other people and to be standing in solidarity with other people as we kind of continue through what's a really challenging time for a lot of people. So, I would encourage folks to, utilize the tools that CSJ has created to be involved. You can always go to our website, which is just CPEHN, CPEHN.org if you want to get involved with us. But, whatever makes you feel fulfilled and makes you feel like you're making your small slice of the earth a better place, I think is just so important for all of us.
Yeah, I agree. And, I hope that, I was, like I said, I think you and I both try to make that through line, that interconnection, right? And so even if criminal justice reform isn't your cup of tea, or healthcare reform isn't your cup of tea, I staffed healthcare for like a year and a half when I was a staffer, and there's so much there, so much nuance. But whether that's not your thing, you can find a connection to these issues, right? There's racial injustice, there's social injustice throughout our society. And so, sounds like you reach out to Kiran and her organization. You can reach out to CSSJ and myself to get involved. And, really just want to thank you, Kiran, so much for the work that you all do. And I hope that you're taking care of yourself as well, and your family and loved ones. And, let's get to November. Let's vote. Let's stand in solidarity with these communities that are, standing often in the streets and asking and shouting for the services that they need. So we should listen to them, right? Let's listen to Black women. Let's listen to brown women. Let's listen to Asian women. Let's listen to all these folks that are shouting from the rooftops.
Couldn't agree more. It was really nice to join you today. Thanks for inviting us, and excited to stay in this fight with you.
Yeah, thank you so much. And really, we'll be tapping in and continue this partnership. And I hope folks that are tuning in now will tune in next week as well. We'll have another conversation. I think we're going to talk about labor and labor, not prisons, right? Which also has a direct connection to healthcare. So, just want to say thank you again. And, we'll be in touch soon. And I hope all those that are tuning in, you're taking care of yourselves, and Black Lives Matter. Remember that. Let's remember Black Lives Matter still.